Are you playing the video, Firoz? Hello, everyone. Welcome to this session of Health Live at Seniors today. Uh, we have a technical glitch uh, with our team here. Our producer is having a technical glitch, and our doctor is just going to join us. He joined in, but there's some problem with the device, so he is joining us in the next 2 minutes. In the meantime, hello everyone. Anita ji, Bridge, Duggal ji, Mr. Gyan Shukla, Mr. Jayesh Gandhi, Sejal Shah. Welcome to this session, February 3rd of 2024. All right. Firoz, are you going to play the video?
Yes, sir.
Yeah.
Oh, that's okay.
Yeah. Doctor, a little on the center, if you can come on the center. Yeah, great. I'm just going to, we're going to play the video in a minute and then we can start.
Give me one minute, Chashma video.
Hello and welcome to Health Live at Seniors today. We are today on Feb 3rd, and as some of you who have been following our Health Live series are aware that in the month of February, the 4th of February, it is observed as World Cancer Day. And every year we've been doing a special session on this occasion. And today we've invited Dr. Amit Sharma from the Narayana Health Hospital to come and speak with us. Before I welcome him, a little about Dr. Sharma. Dr. Sharma has done his MD from Tata Memorial Hospital in Mumbai and then his DM in medical oncology from the Kidwai Memorial Institute of Oncology in Bengaluru. And he has over 10 years experience in oncology. His area of expertise is head and neck cancer, gastrointestinal cancers, cervical cancer, breast cancer, and blood cancers. Dr. Sharma is with the Narayana Hospital in Howrah, that is near Kolkata. And welcome to Health Live at Seniors today, Dr. Sharma. How have you been?
Thank you so much. It is very nice to be here and sharing my experience with you and the audience.
Thank you very much, Doctor. Before I start, you are in Calcutta or Kolkata, I should say, and you've been with Tata Memorial Hospital. You've done your education on oncology over there. Tell me, since the time that you were there in TMH Mumbai to now, what has been the how in terms of treatment of for cancer. Earlier, everybody would come to Tata Memorial Hospital in Mumbai, But now you have hospitals across the country. And what is your first-hand experience of cancer care available across the country?
I think there is, I mean, cancer. There is a lot of cancer institutes are coming up, not only in the metro cities but also the tier two cities. And as far as my experience is concerned, I worked in from Mumbai to Delhi to Bangalore to right now. Last 2 years, I was in Bhubaneswar, which is a tier two city. But let me tell you very frankly that the cancer awareness is really good, and now the institutes are coming up even in the tier two cities. Even in cities like Bhubaneswar, we had a lot of medical oncologists. Some of them are actually passed out. My colleagues from TMH. So the cancer facilities are not only available in the metro cities. To be very honest, from last 10 years, there is a great improvement in healthcare system in the tier two cities as well. And Kolkata has taken, I think, Kolkata has really worked hard in this, at least in the oncology center. There are a lot of oncology centers, not only in Narayana. I will be very frank to you. There are so many other very good institutes here, like Tata, TMC, and Apollo. So I don't think there is any real issue which we used to face in the TMH in my TMH times. A lot of patients from around the country used to come to us for at least the opinion. But at the moment, everything which is available under the sun is available in the Kolkata. At least in Kolkata, I can tell you very, very frankly.
That is very heartening to note because whenever I do pass by Tata Memorial Hospital in Mumbai, and if you go to the corridors, they are just so packed with patients.
Yeah.
And but the fact that it is available across the country, it clearly means that you don't need to really come to all the way to Mumbai and live in expensive hotels and makeshift accommodation places, or even in the corridors of on the footpaths over there for cancer treatment, which is a very
Yeah,
heartening.
actually, if actually when my those residency days when I was there in 2010 in TMH, I actually shared one kind of the pathetic situation. Some of the poor patients over there, because some of the patients who are coming from the other cities, and they don't have such finances as you are saying. They used to sleep in the, I mean, footovers. So that is actually very disheartening to see at that point of time. But I understand at that point of time, the cancer facilities are not that much widespread around the country. But let me tell you now, every single nook and corner, even the second tier cities, I'm again repeating myself, every possible treatment is available, which is under the sun is there. Yeah.
That is very heartening to know. That is, and the fact that for instance, younger doctors like yourself, and we specifically wanted a younger doctor today because you are more with current technology and current practices and current beliefs to come in today. And doctor, because it is World Cancer Day tomorrow, we thought we'd do a very general. We've dealt with head and neck cancer. We've had various specialists who have come here to talk about various cancers. But today, as a medical oncologist and at a leading hospital chain like Narayana Hospital, we wanted you to talk about just, for senior citizens, what are the tips in cancer care and prevention that you would like all of us to know, and what is the care that is required uh, from that front. Over to you, Doctor. So, Dr. Sharma is going to be speaking about cancer care prevention and care. And those of you who have questions, as always, please put them in the Q&A tab on the chat, and we will later, after he makes his points, we will address the questions to him. Over to you, Doctor.
Thank you so much. And okay, this is a very nice topic to talk uh, about the prevention. There is two things which we are going to talk today. One is the prevention, and one second is probably if there is a cancer, then what should we do in especially in the senior citizen situation. So let's talk about it. So when we come back to the prevention part. So if I talk about first males, so what are the common cancers in male which occur, and where we can also prevent them by having screening as well. So one of the important cancer is prostate cancer, which is very common in the males. Second is GI cancers, gastrointestinal cancers, and then renal cell carcinoma, kidney cancers. So and in females, the old age cancers like uterine cancer and endometrial cancer and ovarian cancers. So first of all, we need to know these are the common cancers which are there in the old age population. So first of all, we talk about the symptoms. So that if we recognize the symptoms, then probably we can go to the hospital as early as possible. And second thing is, how can we actually screen prevention? What prevention also means screening. So for the screening purpose, in males, we generally do serum PSA all in the patients who have who are crossed the age of 65 years. And this is basically, if it is increased, we think about it, it could be a serum prostate cancer. And especially in those old patients who actually have problems related to the urination. This is a common cancer. Generally, this is not under screening guidelines. But if patients do have some sort of symptoms, our guidelines say we can go ahead with the serum PSA annually. Then if in patients having any GI issues which are not being solved. GI issues means having alternate constipation, or sometimes they have diarrhea, or sometimes they have blood in their stool. In these patients, generally we also tell them to come and visit us. So and in this patient we can do endoscopy, and if there is something we can detect in early stage, it will help us as well. If there is nothing, at least we can reassure the patient, and patient can continue with annual endoscopy thereafter. So and when it comes down to the breast, there are mammography guidelines which generally started. You should start somewhere around 40 years of age, and you continue for every 2 years span. This is for the sake of carcinoma breast early detection. And in cervical cancer, we all know there is a pap smear testing is to be done. And this is regarding there are not many cancers which where the screening guidelines is there. But for prevention, I think the best part is healthy lifestyle. If they can have a good healthy lifestyle with less fatty food, less a kind of food, healthy food, light food, and in the and regular exercises every day, or they should concentrate at least 2 hours of light exercise every week, and brisk walking every day. So these are the kind of healthy. I personally feel, as far as prevention is concerned, this is also very important to have a good healthy lifestyle. Avoid alcohol, especially in the old age, and also smoking. So this is my part towards the prevention. And second very important thing is these older patients actually they need to take care of themselves, and because some of these patients are living away from the tertiary care centers, and they initially go to the primary health cares. And there the doctors are, they see if the patient has some symptoms, they give the symptomatic treatment. In such cases, I personally feel if they have persistent symptoms, so for example persistent cough, persistent diarrhea, or persistent constipation, or there is some bleeding from somewhere, they should they should consult a oncologist, whoever is available. We initially discussed that now oncology facilities are available almost every nook and corner of the country. So at least they can take their take their suggestion, opinion. And that's from my side. I think this is what I want to tell about. And if there is any question, please let me know.
Yeah, thank you very much, Doctor, for your suggestion, for your opening remarks. And we have a few questions that have come in. I've got on WhatsApp a couple of questions which I will just address. But Doctor, I want to ask you this question. You must be also facing a lot of people who come to you and say that do alternative medicine, alternative uh, uh, therapy techniques work at all in the case of cancer?
I personally feel, to be very honest, what I say to my patients is alternative therapy has no, I mean, proof. As we when we talk about science, science needs a proof. So I personally, uh, I don't. For the things like cancer, I always tell cancer and for example, heart patient, or any disease which can probably, if you delay the treatment, it can cause really real harm. So I personally feel that better you go with the science. Come to us. We have a lot of medicines, lot of treatments available, and as we discussed, they are available in everywhere. And alternative medicine, I personally don't recommend because there is no documental proof.
Uh, yes, that's a point that I think everybody notes. But could it cause any harm? Because what happens is that there are times when people are desperate for some remedy, for some help. Sometimes when it's in an
Look,
advanced stage.
it's in a kind of frame of mind. To be very honest, when patient, for example, a young patient, or young, forget about young patient, an old patient with a malignancy which can be treatable and which can add not only the years in his life but quality of years in his or her life as well. In that scenario, if they go to the alternative medicine, and most of us, we don't have any support, any evidential support. So by the time they come to us, and they come to us in a situation where the cancer is spread to some other part of the body as well, then the chances of having, treating them or curing them is actually going to decrease. So that is the reason I personally feel you meet with us, you decide about alternative medicine yourself. The second problem with alternative medicine is sometimes what happen is those people who are giving alternative medicine are not actually certified homeopathist or certified Ayurvedic people. So these people sometimes give heavy metals in their medicines or steroids in their medicines. So that will probably hamper the treatment of the patient if we even give chemotherapy or something else. And they may come with other issues which can make the treatment difficult for us.
All right. So clearly, and if you do consult a doctor in any other medicine, then you should do it to a certified uh, doctor, because certified doctors will obviously be taking more care, and you will not get into uh, possible trouble. Uh, Doctor, we have a question from uh, Shamla Ravi, who asks, how effective is immunotherapy in cancer treatment?
Immunotherapy, any treatment in cancer is basically based on which stage you are coming to us. And second thing, we check before giving immunotherapy, we check certain molecular markers in his tumor sites. For example, before giving immunotherapy, most of us check the PDL1 status or some certain molecular status. If they are positive, they indicate that yes, immunotherapy can work very well. In certain cancers like lung cancers and for example renal cell cancers, immunotherapy has actually make a lot of difference. Previously, when I was in 2010, immunotherapy was not in that fashion. So at that point of time, we say stage 4 cancer, lung cancer, the life is hardly 10 months or maybe 11 months. But now those patients who have good tumor biology, which can respond to immunotherapy, they are living a long life. I mean, there are people who come to me on immunotherapy, even in stage 4 lung cancer. They're coming to me after 3 years, 4 years, and they are doing well. So the fact is, yeah, immunotherapy has changed a lot about the things. It's not only immunotherapy, even the radiation therapy has evolved a lot. Even the targeted therapy, it is evolved a lot. So in the last 10 years, I think cancer treatment has changed a lot.
Doctor, we have a question from an anonymous attendee who asks, my friend suffered from liver cancer and he got the intimation that he had cancer at a very late stage. And he was told that this is the normal scene with liver cancer. Is this true?
Exactly. That is the problem with liver cancer, because in liver cancer, the general symptoms are actually the patient has little bit of gastritis symptoms, I mean acidity, and patient is feeling bloated. And most of the times, these patients actually go to the primary physician. They write down some symptomatic treatment. Patient may feel good, but after a certain point of time, these symptoms start going down with symptomatic treatment, and then they actually go to the doctor. They do some ultrasound, and then they realize, okay, there is some tumor sitting on in the liver. So by that time, actually the disease progress to a level where it becomes kind of incurable. In liver cancer, the best possible cure is, if patient comes too early, then we can go ahead with the liver surgery. I mean, if we can remove that part of the liver. But most of the patient, almost in my, even in my own practice, 90% of the patient come in the kind of stage where we can't do the liver surgery in those patients, and we are only dependent on, in liver cancer specifically, even chemotherapy doesn't work. The things which work is immunotherapy probably, or some targeted tablets, targeted therapy.
Right. Thank you. We have a question from Katie Dadanchi. Says, Doctor, should senior citizens keep going for mammography in our 70s? Because radiation can be harmful too.
Actually, mammography is very the radiation part is very low, hardly 0.1 MSV, so it doesn't cause that much of harm. And second thing is ki, after 70, I personally feel you may stop at that point of time, and you start with somewhere around 40 years, and you continue till 65. That's fine enough.
Yeah. And another question that she asks is it true that having more sugar and sweets increases the chance of getting cancer?
Yeah, there are certain cancers which are linked with the metabolic syndrome. Metabolic syndrome means the patient, the people who have diabetes, hypertension, or heart disease. These are the kind of syndrome called metabolic syndrome. Any one of them. So, and obesity, like uterine cancer, is associated with this thing. Even we say ki obesity is associated with breast cancer. And not only the association with the cancer, they are also, I mean, when we give the treatment, we have to avoid certain medicines because the patient is diabetic. So I think this is very important. If that diabetic patient and obese patient have always have more chances of having certain cancers, as I told you, uterine cancer and the same GI cancers. Yes.
Thank you. We have a question from Mr. Satish Suri who says he had his radiation therapy which finished in October for prostatic cancer, and he still has little blood and stool when he applies pressure. Is there any advice that you would like to give him?
His radiation therapy is finished when October 23. So it means it's around 3 or 4 months, correct? Yeah.
Right.
So but I will what I would advise is post radiation therapy. Yes, there may be some part of proctitis, inflammation may happen there. So what he can do is, as we say, there is a sitz bath which he can use. He can have one tub and some warm water, some moderate, not much of a warm, just little warm water, and he can sit over there for few time, so for some time. Second thing, avoid constipation. If there is a constipation, he used the same syrup, clamafene and dufalac. So many syrups are available there. Second thing, avoid spicy foods. This is very important. And take light food, and take more fruits, fiber diet. Most importantly, we say that take fiber diets in such situation. Fiber diet means he can use more of the fruits and vegetables and green vegetables.
Right. We have a question from Shamla Ravi again. Talks about are immunotherapy and meningioma advisable?
Pardon? Immunotherapy
and meningioma.
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 Meningioma is a kind of a brain tumor. It's a benign brain tumor. Generally, it requires only surgery and not any other treatment. Surgery and radiation sometimes. That's it.
All right. So would immunotherapy be advisable? No.
No, not it.
All right. Doctor, can you tell us how does one prevent oneself from getting prostate cancer? This is an anonymous attendee.
Okay, so mostly previously we used to see that prostate cancer used to occur after 65 or 70 years of age. Most of the patients, actually 90% of patients belong to that category. And nowadays we are also seeing patients who are in their 60s. So as per se, there is no, the US guidelines and are saying that it depends on patient's symptoms, and we can, as a doctor, we can discuss, patient can discuss with the doctor that should he go for the routine PSA screening. PSA, he can repeat the serum PSA if he has certain symptoms which include if he has to go to for urination again and again, and they always he feels that the bladder is not fully I mean empty after each urination, and he always having the urge of urination all the time, most of the times, and he has to awake at least 5 or 6 times in the night for urination. These are the kind of symptoms which can happen with the prostate cancer, and you have to I think at least after 50 years, if these symptoms are increasing, you should visit to a nearby oncologist to just he will first do the serum PSA. If that is okay, he will send back you home. There may be other reasons of these symptoms like infection. He will give you those medicines. If his serum PSA is increased, probably he will go for some biopsy and he will see. So for prevention, yeah, you have to take care about the symptoms, not in the early age, but maybe after 55 or after 50. You have to be careful.
Right. Doctor, the person Mr. Satish Suri, who asked the question earlier about the fact that he had uh, cancer recently, he's asked, Doctor, but I'm having high BP also. So can I take regularly Cremetin plus for more than 1 month?
Yes. He has to. Actually, we never tell the patient to stop the antihypertensive management, because in fact sometimes when we give treatment, patient in the BP actually increase. So the certain if patient is on antihypertensives or any other medicines related to sugars or cardiac disease, we tell them always to continue these medicines.
Right. Doctor, we have another question that has come in. This is from an anonymous attendee that, are senior citizens, no, there was a session which was done with in Seniors Today, which had said that most senior citizens, most male senior citizens had, uh, will at some time or the other have a threat of prostate cancer. Is it true?
Yes, at certain age, but it's not about prostate cancer. Sometimes it more. In fact, if I will say it more of most of the times, it's not cancer. It is benign prostatic hyperplasia. Benign disease. There is in prostate. There are two types of things which may happen in the older age. One is non-cancerous. That is called benign prostatic hyperplasia. This is more common than the prostatic cancer, to be very honest. And second thing is prostatic cancer. I will probably say the chances of having benign prostatic hyperplasia is more than having prostate cancer, but the symptoms are more or less same. You have to check your PSA, and he will do the if he will feel we will do certain test, physical test. If we feel like it is a maybe a nodule, we will do the biopsy. Otherwise, if we feel like it's a benign thing only, then there are certain medications which will help the patient.
Doctor, we have a question from Girija Ganesh, who's 63. Um, Girija Ganesh says it's sad that the treatment for cancer is very expensive and is very difficult for the common man to handle. Places like government institutions specialized in cancer treatment, like Kidwai, are very heavily crowded and very few doctors. Any place where the treatment is reasonable enough for the common man to approach?
This is very important question. Actually, I worked in these public hospitals, initially Tata Hospital, then Kidwai as well. So that is the reason I feel now the situation may be changing from last 10 years. We have availability of cancer treatment all over the country. And not only that, all the governments are providing some support to the patients. For example, when I was in Bhubaneswar, the Odisha government was providing treatment up to 5 lakhs for the males and 10 lakhs to the females for the treatment of the cancer. Similarly, in Kolkata as well, we have West Bengal health scheme is there, patients beneficiaries are there, and there is also this thing Sasha Shati scheme is there. So I think personally, all the states are providing their own help to these patients. The problem with this is now at the moment these government supports is only most of the schemes are only for, I mean, normal chemotherapy. They are not covering the immunotherapy or more costlier medicines. But right now, because if these immunotherapy or most costlier medicines are actually we are exporting from outside, and very soon we are hoping that our own Indian countries will start providing them. Some of them immunotherapies may be coming. Indian versions are coming in the next few years. So after that, the treatment will also go less costly. And second thing, I always advise all the people that are around the country that I'm not an insurance person, but I personally feel every single person should do insurance for himself or herself for at least 50, 60 lakhs, because this is what we are seeing in the future. And because the treatment might get more and more costly. So but those but it is always better you do. Even for my own self, I have done the insurance. And this is something which is very important in today's era, I think. So but government is helping, and maybe we can feel that sooner or later that medicines which we are exporting from the outside, maybe we will start making it in our own country. Then the cost will come down.
Important advice from Dr. Amit Sharma that, as he said, he's not batting for any insurance company, but the point is that everybody must take an insurance policy. It's interesting what Dr. Sharma has said, that the policy amount that he's indicated should be somewhere in the region of 50 to 60 lakh, which is of course a high amount. And for our senior citizen attendees here today, what obviously it means is that taking an insurance policy is at a high value at a late age is difficult. But
No, that is the reason. That is the reason you have to start it early. There are certain insurance policies. I won't take the name, but they are also providing. I mean, insurance in the older patient. I have done in for my mother at around 75 years of age, and so she recently fell down, and we have all the treatment for her in private hospital without any problem. So there are certain insurance companies which are providing these help as well.
Doctor, can I sorry?
But your point is pretty valid. Better to start it at least somewhere around the 50 years of age, because in older age the premium will get increased. Okay, the premium which is somewhere around 5,000, around 10,000 for 50 lakhs, it will go up to, I mean, 25,000, 26,000 if you start it in older age. So that's what I feel this is a kind of the lesson for the people who are approaching 40s or maybe 50s. They should go ahead with it.
Unfortunately, fortunately, our attendees are mostly senior citizens. Doctor, I know we don't like to promote any specific insurance company, but since you mentioned you've done it for your mother, would you be able to share the company's name so that people who are here can benefit from it?
I think I don't know, but is there, I mean, any problem with YouTube rules and regulations? Then
no, there's no problem. We are doing it for the benefit of our.
So I did my mother's insurance from Star Health.
From Star Health is what it is. I've also seen some insurance from Care, which is also, I saw something for senior citizens. But for those of you here who are not who do not have an insurance, we will like to at some point of time or the other get somebody from an insurance company also to speak with us and advise what we can do.
Because we are talking about some subject which may help them who are listening to us.
Absolutely,
So
absolutely.
this is kind of an important point, that if I mean you feel very light, because once you have the cancer, you have double blow. One blow, first blow is you have the cancer, and second blow is now financial issues start coming. Okay, so if your one thing is sorted out, okay, you know, okay, you have this help from the insurance, then the first thing, maybe, I mean, you can take up that thing pretty well.
Right.
Yeah.
Right.
Yeah.
Yes, absolutely. Nilufar Amlani, I've seen your thing. With age, medical premium keeps increasing. I know. I know what kind of insurance premium I pay.
Yeah, I said the same thing. For my mother, it was somewhere around 25,000. I will tell
Yeah.
you exactly. Yeah.
So, but yeah, we will at some point look at having somebody for medical insurance. Though it's not a topic that we discuss as a health webinar series, but as an addition to this, we will get somebody to do it. We have one last question from an anonymous attendee who's 78 and he's a diabetic. This question to you, doctor, is up to what value is PSA safe and recommended periodicity of testing PSA?
Look, there is no recommendation about doing PSA. Again, I'm telling, it is always related to your symptoms. If you are beyond a certain age, if you are older, for example, his age, 70 or 70 plus age, if you have problem related to your urine frequency, you have increased urinary frequency or retention or something like that, then you meet with some urologist or oncologist. He will do your serum PSA. If it is more than, say, even more than one or more than two, we will have to check not only PSA, we have to check your the digital examination. I told you, na, we have to do some physical examination as well. If in digital examination we feel that your prostate is increased, then, and at the same time PSA is also increased. Normally PSA value could be as low as 0. Okay, so if it is increased even more than 1, we take it, and along with the physical examination, there is a feeling we are finding out that the prostate is increased. We will take it seriously. Okay, so this is the thing. Yeah. and,
Absolutely.
and regarding the frequency of PSA checking, when I'm saying it is already related with the patient symptoms, then basically, if it is dependent on the fact that if the patient comes to us with the symptoms, we do the PSA, we find that it is somewhere borderline. We did the digital examination and we didn't find anything. We send back the patient. Okay, you do the PSA after, say, 1 year or 6 months. That's it.
Right.
Yeah.
Thank you, doctor, for these clarifications and for answering our questions in a very detailed manner. Doctor, as somebody who has seen the cancer, uh, you know, and people getting cancer, do you see that the numbers have increased thanks to urbanization, thanks to the way our eating habits are, and all of that? Has that number changed from, you obviously have a window of just the last 10 years, but has that
Fact is,
number?
the fact is, the not it's changing in a lot of things. Like the younger people are getting the kind of cancers which we supposed to get in the older ages. I have prostate cancer patients in their 50s. Okay, so this is something we have not heard of 10 years back. Second thing, I think that the reason of increasing, definitely there is increasing prevalence of cancer treatment, cancer patients, but there may be the reason we have more population. Number one, we have more detection. People are more aware, and there are I mean, cancer detection. There are tertiary care hospitals almost everywhere. We are talking about that. So the India is changing, and diagnostic process is changing. And the average life of the human being in India is increasing. It is now around 69 years. So as the people are getting more and more older, obviously the cancer, and not only cancer but other disease, we will also find more increase. And nowadays we have more better detection methods. People are more aware about the cancer symptoms. They are coming to us. So that is the reason I think there is also increased incidence of the cancer.
Right. Thank you, Doctor. And on the occasion of World Cancer Day, which is tomorrow, a big thanks to doctors like yourself who are on the front line for treating cancer patients across the country. You've been in various centers yourself, and there are various people and hospitals like Narayana, which are at the forefront of healthcare and of offering healthcare at reasonable medical rates are there. So, full marks to all of you. And that the very fact that cancer care, as you said, is now available in not just tier one cities, but even tier two cities, and perhaps tier three cities as well. It's it's a very heartening move. On that note, Dr. Amit Sharma, thank you very much for being here. Thank you to the team at Nayana Health for facilitating this. And to all of you here, we will be back once again next Saturday, that is February 10th, with another session of Health Live at Seniors Today. Thank you very much and bye. Thank you very much.
Thank you so much.